Hi, I'm Dr. Molly with Your Goals Physical Therapy. Have you been trying to do planks, but your wrist just will not tolerate being in this position? So you're stuck on your elbows doing them, but you really want to progress to get where you can do them on your hands? This video is for you. I'm going to start by talking a little bit about the anatomy on why you possibly have a problem with your wrist. Then I'm going to give you a couple stretches that you can try to do at home to alleviate that. And then finally, we will end with the surefire way to make sure that you don't have any problems with doing any activity that requires you to weight bear on your hands. Because oftentimes, it's not just planks that are giving people problems. It's other activities too. So first, the anatomy. So our wrist, I know we always think of it as this area here, but really our wrist is in this area, and it's a whole lot of little bones. It's a lot of things that need to be stretched. But in our everyday life, we spend most of our time like this or even here. And in all of our functional activities, we're always gripping. We're making things strong this way. And a lot of people actually even get used to gripping and then curling their wrist. So gripping and curling the wrist, they very rarely get used to extending. And so that imbalance actually creates a stiffness, so it becomes difficult to even stretch into this position to allow you to just passively, without any weight, get into this position. So then when you add all of your body weight during something like a plank or pushing yourself out of a pool or any of the other reasons why you might push yourself this way, that's why that hurts your wrist. So my quick tricks are, for stretching, is simply standing. I would start up here and I would push my wrist down. And the goal is to get your palms either, where your forearms are parallel or even slightly below. The trick is to not let your shoulders do this. So you get those shoulders locked down and back. Start up pretty high so you can keep flat fingers, because you don't want to do it with your hands like this. Because when you're planking, that's not how you're going to do it. You want your palms flat for balance. So you want to start up here and then just slowly press the heel of your hand down and together, trying to keep your fingers in contact with each other. Again, you don't want to let them bend. And once you get down to where it's a good stretch, you just hold it 30 seconds or a minute. Now, if you also need it, you can stretch your wrist this way. And this, I would just push here. So now the other thing that you can do is position changes. So when you're doing your push-up, your plank, you can try to keep your wrist straight. That way when you're doing when you push yourself up, your wrists are just straight, so you're resting on your knuckles. Or you can use a weight. So you can just grab the weight, and then it doesn't even matter, because some people prefer to use it horizontally, some people prefer vertically. Honestly, depending on the gym you're at, you might have one of those perfect push-up. They kind of rotate and you grip onto them also. But really what you're trying to do is just ultimately get out of this hyperextended position, because for a lot of people it's just the stretch that's causing the problem. So if you can just keep your wrist in a less stretch position, then that helps. Now, ultimately for the plank, it does not matter whether or not your wrist is here or straight. But for your wrist health, if you can't get into that position and hold it, then that says that there's an imbalance either in your strength, your range of motion. And that's going to be adding extra wear and tear onto your wrist joint, or joints, depending on how you want to look at this. And that can lead to other things in the future. It can lead to grip strength problems. It can lead to carpal tunnel issues. So if you're just noticing the annoyance with the plank and you can get into a habit of stretching and habit of taking care of your wrist, you may be warding off some problems in the future. But let's say that you've been dealing with this for a while and you do occasionally get carpal tunnel syndrome or symptoms, or you do have a real hard time anytime you have to press your weight into the palm of your hand, and you're tired of digging through the internet and trying to figure this out on your own. This is exactly what I help people do. I help take all the guesswork out. I help create specific plans specially designed for each individual person. I don't use anything that's like a stock, like every person that comes in with this problem gets these exercises and it takes exactly this amount of time. Everything that I do is created and it's very specialized to the person I'm speaking to and exactly what their goal is and what they're trying to achieve. So I definitely love to educate people on anatomy, and I want to keep people as healthy and being able to do these things as long as possible. Being able to plank, being able to go swimming and push yourself out of the pool, being able to do all these, being able to push your own weight, whether you're talking about push-ups, bench press, anything where you have to really push and your wrist might be in this extended position. All these things are wonderful activities and you should not be giving them up just over a little bit of wrist pain. So if you are in that boat and you're tired of messing around with this and trying to figure out which wrist stretches are going to be and how you strengthen these things on your own, give me a call. I will actually leave in the show notes below, I will leave a way to set up a phone consultation. So not even an in-person, we will talk just to make sure that I'm the right fit for you. The form that we have you fill out is so that we don't call you when it's not convenient for you. Why should somebody just randomly call you? We'll set up like a time frame and a day that works best for you so that we can make sure that we get you the best information when you have time to even think about it. If you'd prefer, I will also leave my email because I know that in this day and age, sometimes it's just easier not to have to pick up the phone and deal with that. So I will also leave an email. And I hope that this information is very helpful and that you can get back to planking today. Have a good one.